For folks living in San Diego in the year 2025 and who are also eligible for Medicare, there are a lot of Medicare plan options available to them, and San Diego is definitely in one of Southern California's most crowded fields when it comes to Medicare plans. But one plan really seems to stick out, at least for me, which is a plan that is focused specifically on working with those folks who have both chronic health issues like diabetes or heart disease, and also get assistance from the state's Medi-Cal program, or Medicaid everywhere else in the country. So today we are talking about 5 things to look at on the SCAN Strive Special Needs Plan available in San Diego in 2025. Hi, I'm Michael, and this is Michael's Medicare. And if you or somebody you know is trying to figure out what is that best Medicare option for them this AEP or really all year round, just give us a call at the information down below and we can help them to make those tough Medicare choices. Also, don't forget to like and subscribe. Because the number and even the percentage of people moving into Medicare in the last couple of years, and really for the next decade to come, the types and numerosity of plans and styles of plans becoming available are pretty varied. There are general community-style Medicare Advantage plans that are designed to focus on balanced benefits that are relatively leveled out to help the average Medicare beneficiary. But then there are plans like this SCAN Strive plan that is sort of a niche plan. I mean, I guess it's a big niche, but a niche nonetheless for specific Medicare enrolled demographics that could benefit from a more specific plan. By that I mean the SCAN Strive plan is designed for folks who are eligible for Medicare, who also live in San Diego, who are enrolling in 2025, and who have a chronic health condition like diabetes or heart conditions, and also have Medi-Cal to go along with all of that. So you would think, well, each of those classifications would kind of limit the enrollment smaller and smaller, but let's face it, there are a lot of people who fit into this group of folks, and that is who this Strive plan is specifically designed for. All that being said, let's get to one of the most advantageous aspects of the SCAN Thrive plan, which is the fact that because of its design as a plan for folks with chronic conditions and who also have state assistance from Medi-Cal, it means 2 things. One is that as long as someone has one of these health conditions related to diabetes or heart conditions, then they can apply for it pretty much anytime throughout the year, not just during the AEP period, because your health conditions don't stop just during AEP. I mean, so they could also apply mid-June if someone felt like it and they met the criteria. Secondarily, if someone does have eligibility for Medi-Cal, then these costs we are going to go over are going to be paid in full, if not almost in totality, by the Medi-Cal program. So those are the 2 very important things to consider and great advantages to this plan. Now, as we get to the numbers, I want to highlight the maximum out-of-pocket that is on the SCAN Strive plan because, well, I mean, when you look at it, you may get a bit of sticker shock. It is exceedingly high, like eye-poppingly high, at $9,350 for the year, which even if you compare to other San Diego 2025 SCAN plans from the same company, like the SCAN Ulta, which has their maximum out-of-pocket or MOOP at $500 for a year, I mean, it is, well, I mean, it's quite high. But that is actually a good thing. How, you might ask? Well, let me tell you. I'm glad you asked, hypothetically. Because remember, this plan is designed for folks with diabetes and heart conditions who also have full Medi-Cal benefits. So these high maximum out-of-pocket costs will get paid for by Medi-Cal as long as a person maintains the eligibility for Medi-Cal and also has Medicare. The same will go for the monthly premium, which we see is at $25.70 a month. Monthly premiums at this point are pretty uncommon on the general Medicare Advantage market for HMOs in 2025, but special needs plans typically, generally, actually will usually have them because they are designed to be benefits for folks who have extra assistance, like from the Medi-Cal program or low-income subsidy program. And those programs will typically pay for those monthly premium costs. So why is it good and why is it there? Well, it is good and it is there because it means that there is additional wiggle room by the plan to include other benefits on those plans that maybe would require a higher premium and deductible to cover and wouldn't really be sustainable on general non-specific needs types Medicare plans. But because someone does need those specific types of benefits for those specific chronic conditions and have the Medi-Cal coverage, they can include these benefits with the additional costs, well, because Medi-Cal is going to pay for it. Now, before we get to some more serious numbers for benefits, let's talk about one interesting and ultimately daily useful benefit that comes along with the Scan Strive plan, which is the monthly grocery allowance. Because the plan is focusing on diabetes and heart disease, it goes along with the kind of food is directly related to health sort of philosophy. And we all know that healthy food is generally more expensive than less healthy alternatives. So the Scan Strive plan includes a $70 a month or $840 a year, if you put all 12 months together, allowance that would allow beneficiaries to use that money towards healthy foods at grocery stores, which is sort of a win-win, right? Because beneficiaries get to eat delicious, healthy foods. My favorite are peaches. I always forget how much I really enjoy peaches. But also the health plan gets healthier beneficiaries who use less services, who cost less money, and it's sort of a beautiful circle of life. One of the most popular ways for folks with either diabetes or heart disease to help keep those chronic conditions under control is through prescription medication. And the Scan Strive plan is a Medicare Advantage plan with an attached Part D or prescription drug coverage automatically included. This means that medications beneficiaries get at the pharmacies will be covered under this plan. Furthermore, because of the more, let's say, narrow focus of specific health issues like diabetes and heart disease, their medications list on this plan or the formularies are a bit more fortified in the types of medications often overlapping that folks use to control either or both of these conditions. Each medication is going to have a tier depending on the specific medication, and that can range from a tier 1 and tier 2, which have $0 copays, up to things like tier 3, 4, and 5, which will have a higher cost. But again, if someone has Medi-Cal or even has the Low Income Subsidy Program, LIS program, which is a federal program that helps folks pay for their medications based on income, it will help to bring down those costs to a very minimal level. Also very noteworthy is that in 2025, medications like insulin will be capped at $35 for a 1-month supply. And the total yearly cost that a beneficiary could potentially pay for all of the medications put together is at $2,000. That is a cap to how much they can pay, which is almost impossible to reach for folks who have Medi-Cal or LIS, but there is still that limit just in case you do. Last up, and a nice accompaniment benefit that goes along with the Scan Strive plan is the fact that automatically, by default, comes stock with comprehensive dental coverage. This is getting more and more common in the Medicare Advantage plans, but isn't fully infiltrated into the market, is these comprehensive dental plans. I mean, there are still a lot of plans that will just have basic dental coverage. Basic dental coverage that will just cover annual standard cleanings, not the deep cleanings. They will cover x-rays and fluoride, and that is about it on those basic plans. But these new comprehensive dental style coverages that come with the Scan Strive plan will include way more things like crowns, complex services, and even periodontics and endodontic services, as well as oral and maxillofacial surgery, which I don't really know what that is off the top of my head, but it's probably important and it's probably expensive, so it's great to have coverage for all those additional costs as a benefit on this plan. By default, these dental benefits are going to have an allowance of a $2,000 for the year. So, if you are going to get some of these more expensive services, maybe do some in December and then do some in January to help spread those costs out. So yeah, there you have it. A newcomer to San Diego in 2025, a special needs plan from Scan, the Strive plan that focuses on communities who live in San Diego, who are eligible for Medicare and who are living in 2025 and have a chronic health condition and Medi-Cal. And we see how that focus comes out in the plan design. And given the cost and the benefits on these plans, they could be enrolled into by someone who only has the chronic conditions, maybe one or the other, but has no Medi-Cal. But I mean, frankly, that would be quite expensive. And a professional would probably show them some other options. But for those folks who do meet all three of those criteria, it is a great plan that maximizes some of the benefits that would really help to keep folks healthy. All right, so that's it for today's Michael's Medicare. And if you or somebody you know has questions about their Medicare health plan or Medicare questions during this AEP or really all year round, please feel free to reach out to us at the information down below, and we are happy to assist them over the phone or in person at one of our many Southern California offices in English or Espanol. Also, don't forget to like and subscribe so you can get notified when our new great Medicare content comes out every single week, and in fact, doubled up during AEP. So for Michael's Medicare, I, of course, am Michael, hoping that you have a great rest of your day, and goodbye.